Hey survivors, it's Self-Care Queen. Welcome to my channel. Grab a cuppa and settle in. Today's video is going to be all about borderline personality disorder and dialectical behavioural therapy. The NHS say that BPD is a disorder of the mood and it affects how a person interacts with others. They then go on to list the 4 main symptoms of BPD, which are emotional instability, disturbed patterns of thinking or perception, impulsive behaviour, and intense but unstable relationships with others. I'm going to be using some notes to help me explain what BPD is because it is a very complex disorder and I don't want to miss anything out. People who have BPD are hypersensitive. So for instance, a small trigger could set them off, and in the result of that, they're very high reactive. And it feels like there's no middle ground, there's no in between. So for instance, if somebody cancels on me, I'm very sensitive about that and I can instantly get really angry, and because of that my reactivity is very fast, that I will want to either send that person a very abusive message or I will want to harm myself because of that. And there's no middle ground, there's no kind of grey area, it's very extreme. And 1 in 100 people have the diagnosis of borderline personality disorder, and it is because of a variety of different factors. Up to 20% of it is biological, so is there a family history of mental health? And the rest, so the 80% of it, is social, your social factors. So did you grow up in an invalidated environment? Were you bullied? Were you abused? Were you neglected? Were you overly criticised? So, and then putting the bio and the social together makes it a biosocial, genetic and social disorder. I first got my diagnosis of borderline personality disorder when I was 18 years old. And at this point in my life, I had been out of CAMS, which is Child and Adolescent Mental Health Services, for a year. And I was coping, I was stable, I was managing my medication. I think I was on fluoxetine, 20 milligrams, which is an antidepressant. And I was under the treatment of my GP. I wasn't in any adult services. Then in the autumn of that year, I was feeling quite depressed. I kind of went back into my depressed state just a little bit, but I wasn't really concerned about it because I could still get out of bed most days, every day, and I was eating, I was sleeping, I was seeing my friends. So it wasn't anything like how I experienced depression before. And then I had some really shocking news from my mum that she's gotten back together with my biological father, my dad, and that threw me because he had never been in my life at all, and I felt very betrayed, very confused, and I was very shocked, and that set me off, and I relapsed a lot. In the space of a week, I just spiraled out of control, and I ended up calling the crisis team. Everybody, by the way, in the UK, I don't know in the other countries, but everybody in the UK has, in each borough there's a crisis team or a home treatment team, and you can work with them from anything up to a couple of days, I think up until 4 weeks. And that is when you are in crisis, when you maybe feel suicidal, or when you have had a suicide attempt, you work with them for a short amount of time and they kind of discuss with you and with their teams where is the best place to go from that point. So whether they refer you on to more treatment or whether they refer you back to your GP. So that is basically what a crisis team is. So I referred myself to them, and they referred me to the adult services. Again, I waited a long time, went to my assessment. I think I had 2 assessments at the adult mental health services, and there were long assessments. When I say long, like an hour, and then I had two hours. So I went 1 week and then I went back, I think at the end of the month, and we spoke more about what was kind of troubling me, what my main areas of symptoms were and things like that. At the end of the second assessment, I received my diagnosis of borderline personality disorder. And at that time, I was very confused. I didn't know what a personality disorder was. I just got to grips with depression and anxiety and kind of battling them and overcoming that. And then I got that diagnosis. I wasn't the happiest at first. I felt very alone, to be quite honest with you guys. I felt lost. I felt hopeless because they gave me that diagnosis and they said, oh, we'll put you on a waiting list for some therapy, but it can take up to 9-10 months. And I was like, what am I meant to do in that time? What do I do when I feel suicidal? What do I do when I've had an argument with my friends and I want to do something to myself? It was a very lonely time for me. And again, no one explained how I developed BPD. They just gave it this diagnosis, wrote a massive report, like about a 6-page report, sent it to my GP, sent it to me, and that was that. After I got my diagnosis, about 6 months into having that diagnosis, I moved house, and that meant I moved boroughs. So all of my care got transferred. Well, I thought it was going to get transferred over to the borough which I live in, and it didn't. I had to go to my GP and be really proactive and say, cool, I've got this diagnosis. I was on this waiting list, but now I've moved, so can I just be added to the waiting list? But it was not simple because each borough operates in a different way. So I had to be assessed by iCope, which is a provider that your GP has in place, or you can self-refer to iCope as well. It's a primary care provider and they offer counselling, CBT, some like group therapies, some skills groups, and in some areas they are called IAPs as well. There's lots of different names. I think in West London, I think it's called Step Up or something like that, but they are primary care service providers, which means you can self-refer and your GP can and your GP can refer you. So I got referred to iCope, and iCope looked at my case, read all my reports and said, oh, we think you're a little bit too complex for us. Referred back to my GP. My GP made some other referrals, and I was too complex for most primary care places. So then they started referring me to secondary care. And in secondary care, they work with a lot of people who have a lot of complex disorders or a lot of complex issues. And for secondary care, upon reading all of my reports and things like that from CAMS, they thought I wasn't complex enough. So for a good year and a bit, I was between primary care, secondary care, and they were both saying no. And there was no middle ground. There was nowhere for me to go. And I was like, oh, this is great, isn't it? I've got this diagnosis. I came off meds at that point. I wasn't on any meds. At this point in my journey, I relapsed. So a relapse looks different to everybody. A relapse for me is when I stop using the skills I've learned, and I shut down. I don't see my friends, I don't really eat, and I act out in an unhealthy way. And my unhealthy way is different to a lot of people's unhealthy ways, and vice versa. Like, everyone has their own different ways of dealing with things. So some people might like to deal with their emotions by drinking. Some people might, deal with their emotions by smoking a lot. For me, it was taking an overdose on medications, because I felt like when I did that, I was in control. So I relapsed, and I referred myself to, the crisis team referred me to a crisis house. A crisis house, there's not many in the country, and the one in my area is the only women's one in the country. And in this crisis house, there are 12 bedrooms for 12 women, and you can stay there anything from up to, I think it's 2 weeks. I think it's a week actually. A week up until 6 weeks is the complete max you can stay there, and you see a support worker each day, and it's a place to keep yourself safe. So I was in a crisis house for 2 weeks, and then they referred me to a charity called Body and Soul, because they thought dialectical behavioural therapy would really suit me while I'm waiting for all these NHS referrals. So I thought, oh, what's this now? Like, is this really gonna work? And it did. DBT changed my life. Dialectical behavioural therapy was created by Dr. Marsha Linehan. Sorry, Marsha, I think I pronounced your surname wrong. And it was designed to help people who struggle with their borderline personality disorder symptoms to use practical skills and to learn more effective ways of dealing with their symptoms. In DBT, there are 4 main areas of focus, 4 main modules that you work through. The first one is distress tolerance. So this module helps you bring your distress levels down. So when you hit crisis point, instead of acting out on those urges and those emotions, you kind of stop and you bring that level of distress right down. And then from there you can deal with them. So that's what that module does. The second module is mindfulness. So I'm sure a lot of you are aware of mindfulness, but in DBT, it really helps you become present. It helps you concentrate, and it helps you make healthier choices. The third module is emotional regulation. So this will help you identify and name your emotions and to keep them more regulated throughout the day. And the fourth module is interpersonal effectiveness. And this module helps you keep and maintain healthy relationships with others. And it also helps you in terms of conflict, in terms of what to say and what to do. And it just helps you be able to assert yourself as well and create boundaries. Dialectical behavioural therapy can be delivered individually, so with you and a therapist, or it can be delivered in a skills group. And I emphasise the word skills group because it's not group therapy. Group therapy is when you sit in a group with other people and you have a certain time frame to share what's on your mind or what has been going on that week, and you go around in a circle. And a skills group is when you are in a group and you share a skill that you've worked on that week and how that skill has been for you. So for me, I find skills groups more effective than group therapy. That's just my personal opinion, because I feel like in a group therapy situation, I'm very empathetic. So I really take on other people's emotions. So I'll go in feeling pretty crap and I'll come out feeling 10 times worse usually, because I want to take on everyone else's stuff. And so yeah, I really prefer skills groups because I can see how people have used that skill in different ways and how they've adapted it for themselves, so you can learn off each other. I started my dialectical behavioural therapy course at a charity called Body and Soul, and I went there once a week for 2 hours, and I was in a group with I think 13 other people. And in the group there were people from different backgrounds, different ages, but everybody in that group either had a diagnosis of borderline personality disorder or PTSD, and they had tried to take their own life at some point before. So we were all connected from that in that group, and it was really nice to be in a group where you don't feel like the outsider. When I first started DBT, I ordered this book and everybody in the group had this book, DBT Skills Training, Handouts and Worksheets. I like to call it my Bible because it literally has everything in here to keep me safe, and to keep on track and to manage my everyday life. So in the book it has all the different modules and it has worksheets that you can work through. So it's like you get different homework tasks. DBT sessions, I'm sure, are very different, but how they were structured for the group that I was in, we went in, we all did a mindfulness activity together. And when I say mindfulness, we're not just sitting there with our arms out like this, with our eyes closed, breathing. Some sessions we tried that, but most of our mindfulness tasks were very engaging, I would say. So one of my favourite ones was we each got a minstrel sweet chocolate and we put it on our tongue, and we weren't allowed to swallow or eat it. We had to keep it on our tongue for 2 minutes, and I found it very difficult because I really had an urge to swallow, but we had to just keep mindful and keep our attention on not swallowing. I remember another week we went in, there were loads of balloons on the floor, and we had to keep them up from dropping on the floor. Another time what else have we had to do? Oh yeah, we got some string with loads of knots in it, and we had to like unpick the knots. So yeah, they were very engaging mindfulness tasks. So after we did the mindfulness task, we would go around and say how we found the task. After that, we would usually go through our homework. So each week, you get homework that's in the book. After that, we usually have a break. And then after the break, we come back and we learn a new skill. From there, we then get given that new skill as homework. And yeah, that's it. That's the end of the group. I really liked the format of it. I found it really supportive, and I liked hearing everybody else's, how they've done their homework. So yeah, the homework was like, so this one was all about emotions. This was an emotion regulation homework. So we had to like think of what the prompting event for that emotion was. So I wrote that I felt sad. So okay, how did I feel sad? What was the event? So I would talk through that. Then I would talk about like my urges, what urges I had when I experienced that emotion, what I did, how I did it. So yeah, that's just one example. Dialectical behavioural therapy was not easy at all, I tell you that now. It was tough some weeks. I would come home and I would cry in the session. Sometimes I would cry because I felt like I couldn't do it, or things were just not landing in my head. But it was really important for me to be open with myself and my therapist in those situations. But DBT literally changed my whole like outlook and how I carry myself through each day. For me, the key module that really like helped me was emotion regulation, and that is where you can like identify and name your emotions. And I realized what my triggers were, whereas before I would have thought like, oh, I don't know why I got triggered, I just felt suicidal. But now I realize, oh, okay, I felt suicidal because that happened. Dialectical behavioural therapy is very difficult to access at the moment currently in the UK. This is because of a lot of funding within the NHS, and also there is not enough dialectical behavioural therapists who are trained to deliver it. So that is why a lot of people haven't really heard of DBT, because it's not offered really widely to people. And if it is, it's offered to people with complex conditions, so people who have very severe cases of BPD. So yeah, I really do believe everybody should have access to it, because there are some amazing skills in here, I think, that are suitable for everybody. And if everybody learned this from like a school age, we would all be more mindful and more present and more regulated. But unfortunately, that is not the case. I still struggle. I still have to manage my emotions day to day using all of the skills in this book. But there are times when I've relapsed. For instance, I relapsed last week, and I relapsed in the summer, and I haven't really spoken about it openly until now, really, because I felt a lot of shame and I felt really angry towards myself, because I thought, oh, why did I do that? Why did I relapse? Why did I do that? Just because I felt this. Why didn't I use my skills? But I know that I shouldn't be angry at myself. I should just forgive myself and move on and pick the book up again and look through it. So yeah, like I will relapse, and I know that is part of my recovery journey. No recovery journey is you finish therapy and you're better straight away. It is an uphill battle, like, trust me, and you will fall down a few times, but it's about how quick you get back up again. And I've realized after doing this therapy, if I ever have a relapse, so for instance, I had a really bad relapse last week, I got back really quick. I recognized what I did wasn't the best way to handle it. I wrote down what I could have done in that situation, and I'm back to working through each day. So yeah, I'm not saying DBT will cure you, but it really has helped me recognize my emotions, have more stable relationships with myself. Currently, there is no medication on the market which is designed specifically for borderline personality disorder. And on the NICE guidelines, NICE stands for National Institute of Healthcare and Excellence, it explicitly says do not medicate on the borderline personality disorder page, because yeah, as I said, there's no medication on the market right now out there, and it says that the treatment option is long-term psychological care, so psychotherapy or dialectical behavioural therapy. And it says in some cases you can be prescribed medication, and that is if you are in a very high crisis state. When I had my relapses in the summer, I had about 4 very close together. To prevent my 5th one, I was put on quetiapine, which is an antipsychotic, and I was very reluctant to take this at first because I was like, oh nice, it says don't medicate, why are you giving me these medications? But I kind of reached my wits end with it all. I was very dysregulated, and to help me use my skills, they prescribed me 50 milligram of antipsychotic, of this quetiapine tablet. And yeah, it has been working, it has been helping, but I don't want to become dependent and reliant on it. So when I get this specialised therapy, this next bit of therapy that I'm going to get to do with my attachments and my dependency, I will use that time to come off my medication in a safe way. So yeah, a lot of people with BPD are medicated, a lot of them aren't. But I would say have medication if you really, really need it and know what it is doing to you and know why they are suggesting this. So for me, being on quetiapine, it is to act as a little bit of a sedative to calm my reactions down a little bit. And yeah, I'm not the happiest that I'm on it. I'm not like, oh, woohoo, I'm on these antipsychotics and like it's really, really amazing, because I'm not feeling my emotions the way I'm meant to be feeling them. But that is just my point of view, and I am very ready to come off them. But as I said, I feel like I am not currently in any sort of therapeutic environment to be able to do that, so I am staying on them until I get that therapy. Thank you so much for watching my video. As always, just a reminder, I am not a licensed therapist or a healthcare professional. I simply use my own lived experience to help educate and support you guys. If you do need some more advice about mental health, or if you think you might have a mental health condition, please do go to the NHS's website and book an appointment with your GP or your doctor, and call any of the crisis lines like Samaritans, or text the Shout text line. I've put those details below. Please do comment and subscribe and share this video with anybody who you think may need it. And my next video is going to be all about crisis planning. So how to plan to prevent a crisis, how to make a crisis plan when you're in a crisis, and basically what to do when you've hit that point. Keep surviving, thriving, and stay strong.